Hi there. Let's quickly talk about digoxin. Another name for it is lanoxin, which is the trade name, but digoxin is the generic. It's a medication that is used to treat heart problems. It helps with conditions like atrial fibrillation, flutter, and congestive heart failure by controlling the heart rate and improving how the heart pumps blood. First, remember that the normal digoxin level in the blood is between 0.5 and 2 nanograms per milliliter. Too much or too little can cause problems. Now, what happens if digoxin levels go too high? You might see signs of toxicity, like a slow heart rate, which we call bradycardia, nausea, dizziness, a loss of appetite, anorexia, that's what they usually call it, or even a blurry or yellow vision. Now, if toxicity occurs, the antidote is Digifob. Now, here are safety tips. You always want to check the patient's heart rate before you give the digoxin. Usually, if it's less than 60 beats per minute, you want to hold the medication and let your doctor know. And then one more thing, always check the potassium levels because low potassium, which is called hypokalemia, it can make digoxin toxicity worse. So, that is it with the key points for you to understand and safely use digoxin. Now, this also was something that you will see on exams. You may not see it direct, but it may ask a question. For example, a nurse is assessing a client who is taking digoxin to treat heart failure. Which of the following findings is a manifestation of digoxin? So when they say a nurse is assessing a client who is taking digoxin to treat the heart failure, and it asks which of the following findings is a manifestation of digoxin toxicity, it's just basically asking what is the sign and symptom of that digoxin toxicity. So if you're reading, your book and you see, some questions, look at the signs and symptoms. So you might see, if you see something called bruising, there's no bruising in digoxin. A report of metallic taste, you won't see that. Muscle pain, no, you won't see that. But a report of anorexia, that's something you would see. So when you're looking at questions and you're taking your exams, look at what the question is asking. Don't just look at the beginning of the question. So I hope this helps you. If you do have any questions, please put a comment below and don't forget to subscribe to my page. Thank you.